universal plan, which means it covers everyone, except that the public plan or the government option would cover everyone, and it would eliminate the private insurance industry altogether. The crux of that debate is that people who advocate for a single payer option believe that you could eliminate the insurance industry, and the majority of Americans would be satisfied with that. But unfortunately, the reality of the polling shows that the majority of the country is not entirely ready to go to a 100% government plan. And we believe that if that's not what people want, if there are people who are happy with private insurers, and we believe that private insurers can be regulated in a fair way, then we should work together as Americans to get something that really covers everybody and that we all can agree on.
I think you said something very important there, which was that the single payer option is a specific policy, right? But it's about universal coverage, as is what many Democrats or progressives support, which is broadly the concept of universal coverage, where every American is covered. Where and single payer is a specific potential way to get there, and there are other ways of also getting there, right?
But the most important thing is we think that everyone has a right to health care, and that's what we agree on, and I think we can work together to make that happen.
And that actually sort of helps, I think, pivot back to the town hall debate a couple days ago between Senator McCain and Senator Obama, and moderator Tom Brokaw specifically asked the question about whether health care was a right. I think he just said a right or a privilege. Is that right?
I think he said a right, a responsibility, or a privilege.
Okay, and Senator Obama answered he felt it was a right, and then he sort of talked about his plan and actually contrasted it with Senator McCain's. Senator McCain answered responsibility. What was interesting to me about the question is I have never heard it posed where healthcare is a responsibility. And so I just felt like that was, I don't know, that was something new for me.
Yeah, and I have to say, as I was watching that, I was happy to hear for the first time in what I feel like is the length of my political consciousness, that we actually had a debate about what type of role government should play in people's lives and the good that government can do, or should the government stay out of it even when people are suffering. And I think that's a great debate to have, and I'm happy to ask that question. It still contrasts the fundamental difference between these two people. So one person sees healthcare as a commodity and a product that can work for people in a model where profit is what's driving it. And Senator Obama sees it as a right, and as a human being, you should be able to get care when you're sick. And that it's not a commodity, but there is a way that there are some private solutions that can work, but it can't be just a 100% profit-driven model. It deserves regulation.
We've actually been partnering with Healthcare for America Now and Care2. We've done some work around really just, this is a really core basic question, which side are you on? Are you on the side of the people or sort of supporting private insurance? Is that right?
Right. So what we're asking everyone is to declare themselves. And because we think that there's a clear contrast. There's the insurance industry that is a private, unregulated, bureaucratic market that leaves people on their own to figure out how to pay for health care and how to get the care they need at the same time. Then there's our side, which is a guarantee of quality, affordable health care for everyone. Pretty simple. We want you to be on our side and then work with us to get all the members of Congress on our side so we can win. And that's what we're asking everybody to do, and that's why you should tell all your Care2 people, just get on our side.
Get on their side. It's hard to get the side of everybody. A lot of organizations have sought to sort of inject their issue into it. Obviously, healthcare is a core issue that a lot of people are concerned about this year. And you've had some success sort of activating your grassroots folks around that. Talk a little bit about what you're doing there.
Well, we decided to do an action to make sure that the CBS traditional debate had a good question about healthcare. We knew that the town hall debate that we just saw would have people's questions, so we kind of assumed that at least somebody would ask about healthcare because we know people care about it, but we were concerned that when just the media was in charge of it, that they might not ask substantive questions about issues that people care about. So we asked our supporters, some of you who have signed up through the Care2 site, to send an email to the political director of CBS and say what question you would like for Bob Schieffer to ask. And to our wonderful surprise, over 4,000 people wrote letters to CB. Political director was a little bit overwhelmed and a tiny bit angry, but he was definitely impressed, and he is going to personally deliver everyone's responses to Bob Schieffer. And CBS is going to do a story about healthcare and the reality of healthcare in people's lives as a result of our actions. So I think it's great when people can really influence the media in this way, because, you know, while some of us who are activists are very aware of this, there's a lot of people out there in the country who don't really get to hear what the candidates really think on these issues. Media Matters did a really great report that showed that during the primaries, healthcare was only talked about 8% of the time. And in that 8% of the time that they talked about the third most important issue in America, 50% of the questions were about abortion, which is a women's issue that is very serious and certainly worth some debate. But we all know that the questions were not about women's health. And really, that's not the most important thing when people can't take their kids to the doctor and, you know, people can't get the preventative care that they need.
We're approaching Election Day. What is HCAN looking to for 2009? Obviously, we're sort of in this very intense period now where we're having this very heated national conversation that includes healthcare among many other issues. What are you guys looking ahead to for 2009? And the second part of that question, which I always like to ask when we're talking to people based on our audience, is how can CARE2 members help HCAN going forward?
Well, there's two parts of our plan, and the first part will end in 26 days. And the first part is what we're doing now, which is making sure that before the election, members of Congress really hear from their constituents that people want quality, affordable health care. They're not going to settle for anything less. They want all the principles of our statement of common purpose to be met, not some of them, not, you know, maybe we'll make it a little bit cheaper for you, or maybe we'll make it a little bit better, but we want it to be affordable and we want to be able to have access. And that's what people are doing right now. They're calling members of Congress. We're going to get a majority of Congress on our side before the election.
Really?
Yes.
Fantastic.
And we want to go into 2009 with a real mandate to get this done and get it done quickly. And I'm pretty confident that we'll achieve that. Now, 2009, though, is where the rubber really hits the road. And while we might think that we're all really tired and working really hard now, we've only just begun. Because when
Cue the carpenter.
when it comes time to actually get Congress to come together, write a bill, pass it, and get the people the health care that they need, we know from 1993 and really from the past 90 years of history that it's no easy task. And that's really, we're going to need CARE2 activists and activists from all over the country to keep, you know, the fire burning and keep their feet to the flames, because we want to get this done in the first session of Congress and leave the first session of Congress 2009 with a health care bill that meets our principles.
How does the economic crisis impact your thinking, planning, etc.?
Well, you know, there's lots of different ways to look at this, and I think that the knee-jerk reaction is, oh, we just spent $700 billion and now we can't afford health care. But I think that's exactly the wrong way to look at this. I think that the reality is that we spend billions of dollars on all sorts of things every day, including the war in Iraq and all of these other major, I think, policy errors, when we could be investing that money in the people of this country and giving them the things that they need, like health care and a stable economy. And we would be more prosperous as a result. So I think the better way to think about it is this crisis creates an environment in which we can make an argument that we should have been doing this all along, and now's the time to really get it done. And there's lots of things that we could not be spending money on, and we could spend, you know, half that much money and get health care and fix the economy and, you know, give the American people the government they deserve.
Fabulous. Levana Layendecker, give me what's your website address, HCAN?
Healthcareforamericanow.org.
Awesome. Thank you for your time. Good luck.
Thanks.
Bye, CARE2.